Has anyone had a doctor's appointment lately or received confusing paperwork about a recent medical visit from their health insurance company? Not long ago, my 4-year-old got hurt at school. He cut his head, which required stitches, so I had to take him to the ER. As a mom, I was frightened, but as a healthcare researcher, I dreaded what complicated paperwork we'd have to complete and how long we'd have to wait before my son could be treated. Despite my expertise, I am still easily confused by our healthcare system, and so is the average American. Regardless of whether you get coverage through your job, parents, the government, or none at all, there is one universal fact. At some point, we all get sick and need health care. And news anchor Walter Cronkite describes our unfortunate reality best. Our system is not healthy, caring, or a system. It is like this by design. What we know as the current healthcare system is the result of policy decisions dating back to after World War II. Western Europe needed to be rebuilt and develop government-funded universal coverage for its citizens. Meanwhile, the U.S. established Medicaid and Medicare to provide health insurance only for low-income, elderly, and disabled Americans. Universal health coverage was not a viable option for the U.S. Powerful legislators, physicians, and healthcare companies negotiated the system's design to serve their distinct interests. Individual patients' healthcare needs were never at the core. The limited expansion of Medicaid and Medicare and increasing privatization of healthcare meant that many Americans were uninsured in the late 20th and early 21st centuries. Then and now, most Americans, about 50%, got health insurance through their jobs. While this is a good employee benefit, it means that most Americans lose their insurance when they lose or change jobs. Beyond that, the U.S. has spiraling healthcare costs that are the highest among our peer countries. Those costs took up nearly 1/3 of our national budget in 2024. That same year, 31 million Americans went into medical debt due to inability to pay for care. When the 2010 Affordable Care Act, also known as Obamacare, was enacted, the U.S. had the largest percentage of uninsured individuals in high-income countries. Even worse, the most marginalized Americans were more likely to be uninsured and to die from preventable health conditions. But this is no accident either. The U.S. healthcare system was designed as a deliberate patchwork with inequality baked in from the beginning. Race and class shaped access to and the quality of care. During the era of Jim Crow racial segregation, African Americans couldn't get treatment from white providers. They could only be seen by other African Americans in substandard facilities. And other Americans of color and low-income white Americans also lacked affordable coverage and care. Documentation status also limited non-citizens' eligibility for Medicaid and Medicare. In the 1970s, undocumented immigrants were legally barred from those programs. In subsequent decades, some documented immigrants were excluded. And by 1996, even some tax-paying green card holders were excluded too. This healthcare system design created significant challenges for Danya, the pseudonym for a Dominican immigrant and green card holder I interviewed in 2013. As a Latina with darker skin tone who speaks English with an accent, she felt that these factors contributed to her mistreatment in Boston healthcare facilities. She told me, "I have definitely experienced discrimination, of us being abused and mistreated in hospitals for being Latino or an immigrant. They leave you waiting for hours until you are almost dead to treat you." Danya was also brought to tears from her inability to communicate with and being ignored by providers. Can you imagine being sick and in pain and unable to tell the doctor what is wrong? I wish I could say that Danya's experience was not the norm. But our healthcare system fails people like Danya and many of us in this room because we are at the mercy of a system that we don't understand and that prioritizes profit over people. And in today's politically charged environment, immigrants, especially those racialized as non-white, are vilified as undeserving of health care. Manuel, the pseudonym for a Salvadoran pastor I interviewed in 2016, stated plainly, "It is better to be a dog than an immigrant. Because if we find a dog that has been hurt in any animal hospital, we will accept it right away. but an immigrant will be rejected. Pastor Manuel's quote speaks to the indignity that immigrants and citizens face in our healthcare system. For decades, millions of Americans were uninsured and could not access coverage and care. But in 2006, Massachusetts became a national leader when it implemented comprehensive health reform, expanding access to coverage for all its residents. That successful reform led to 97% of the population being insured and became the model for Obamacare in 2010. Now, the goal of Obamacare, similarly, was to expand access to coverage through three major components. First, an individual mandate requiring everyone to have coverage. Second, expanding Medicaid for more lower-income individuals. And third, establishing a health insurance marketplace where middle-class Americans could buy coverage with government subsidies. Obamacare also removed pre-existing health conditions as a basis for denying coverage and allowed young adults to stay on their parents' health insurance until age 26. Nevertheless, Obamacare was the subject of political protest and Supreme Court challenges. The result? Some states opted out of the Medicaid expansion, which meant that eligible low-income citizens could not get Medicaid. Beyond that, the initial rollout of Obamacare was bumpy. Even in Massachusetts, technical difficulties caused some people to lose coverage. And despite the misconception that immigrants take advantage of the healthcare system, most were legally barred from Obamacare provisions. Let me say that again. Undocumented and many documented immigrants were excluded from the Medicaid expansion and other Obamacare provisions because of existing federal policies. Now, because Obamacare was built on a successful model here in Massachusetts, you would think that the state was ready for Obamacare implementation, right? Wrong. Obamacare actually undermined healthcare access in Massachusetts in two ways. First, Obamacare required more paperwork and documentation to apply for coverage. This meant navigating a confusing website where people had to go to submit that documentation and paperwork. But what if you weren't computer literate? Or English wasn't your first language? Better yet, when asked to select the coverage option, what if you don't understand what is a deductible, tax penalty, or advanced premium tax credit? How can anyone make informed decisions under these circumstances? This complex enrollment process led to eligible people being denied coverage and those who got coverage unsure of how to use it. Further, Obamacare created confusion about immigrants' eligibility. Though most Massachusetts immigrants weren't eligible for Obamacare, they could still get coverage through Massachusetts programs. Kelly, the pseudonym for a health advocate I interviewed in 2015, shared her frustration when clients told her, "I went to the community health center to complete an application, and I was turned away because I am undocumented." Some healthcare navigators didn't understand eligibility differences between Massachusetts and Obamacare programs based on legal status. As a result, eligible immigrants were denied coverage in the state. Furthermore, increasing racialized immigration enforcement generated fear of obtaining care, even for those who had coverage. Some immigrants I interviewed felt targeted by ICE and police on their way to hospitals due to not looking American. Gloria, a pseudonym for a healthcare provider I interviewed, described the healthcare impact of this enforcement in 2019. She told me, "There was a time when a lot of our patients were missing their appointments, and so I called them to ask, 'Why aren't you coming in? What's going on?' And they were like, 'There are immigration raids happening since 5 o'clock in the morning. We are not going to work. We are not doing anything.'" These healthcare challenges were the reality for the Brazilian, Dominican, and Salvadoran immigrants I interviewed in Boston. But their experiences reflect those of the general U.S. population and our complex healthcare system. So while Obamacare expanded access to coverage, people were unsure of how to get the care that they needed. Added to that, intensifying racialized anti-immigrant sentiment meant that access to coverage did not guarantee access to care. To be sure, Obamacare had some major successes. Most importantly, it led to reduced the uninsured population by half. And despite many undermining attempts, Obamacare survived because of its popularity. But if any of you have been listening to the news lately, you've likely heard that our healthcare system is in for another major shift, the end of Obamacare. This end is not happening all at once. Rather, federal lawmakers are dismantling key Obamacare provisions one part at a time. With the passage of the Big Beautiful Bill Act in July 2025, there will be drastic Medicaid cuts, leaving millions of Americans uninsured. And the loss of government subsidies for middle-class Americans to buy coverage in the health insurance marketplaces will be substantial. And without the individual coverage mandate, Americans unable to afford their premiums will likely go uninsured. And our lawmakers have not prepared a plan to replace Obamacare. Simply put, the end of Obamacare will be devastating for our healthcare system and our individual and collective health. Our healthcare system and healthcare access as we know it will likely completely collapse. That thought frightens me, and likely many of you in this room too, because this is the only system that we have ever known. Has anyone heard the adage, the devil you know is better than the one you don't? But the demise of Obamacare and our healthcare system would create an unprecedented opportunity to build something new from the ashes. We can create a better healthcare system. It is a system where people can get the coverage and care they need from providers that listen to and respect them, and where patients are treated with the dignity they deserve. It is a system where the health care that you get will be better than what dogs receive, and your ability to pay won't affect the quality of care that you get. And if you're worried about cumbersome paperwork, there will be social workers and healthcare navigators who can help you effectively navigate the system. If you need a medical interpreter to converse with your provider, those will be readily available. And it is a system where all healthcare professionals will earn living wages so that they can receive the type of care that they provide to others. And it is a system where medical students can be incentivized to go into primary care so that they can earn enough of a living to pay off their medical debts or have that debt forgiven. Now, we in this room may not live to see it, but I certainly hope that my children and the next generations will build it. We need to fix the health injustice that has plagued this country for the last century. Because as Dr. Martin Luther King Jr. once said, of all the forms of inequality, injustice in health is the most shocking and inhumane. Let's work together to build a future where that injustice ends. Thank you.